Yes, nilikuwa nafikiria, unajua in this world we have a lot of things going on. So nilikuwa najiuliza maswali. What if Kenya, the Ministry of Health, the hospitals that you are working in, if they would respect nurses in such a way, when a nurse prefers to advance their studies, they go and do nephrology nursing, they go and do critical care, they do oncology nursing. What if such nurses, you let them serve the patient that they want to serve? For example, if someone did oncology nursing, let them go in an oncology unit and serve those patients. Don't let up do oncology nursing and then take them to the ICU to work there. It doesn't make sense, because at the same time a person who has done critical care, you take them from the ICU, take them to the medical surgical floor. Like, what does the management benefit with when they switch such nurses? You should be working where you are ready to work. Because, see, when I decide I want to do nephrology nursing, it's because I have passion, or I'm passionate about nephrology nursing. So let me work in a renal unit, in a dialysis unit with renal patients. Don't just take me anywhere just to frustrate me. It doesn't make any sense. And then when you take me, if I do nephrology nursing, of course my job group has to change. I should be paid as a nephrology nurse, not just a normal nurse. You see, I mean, it's strict, it's serious, but no one cares about your education. So, you see, someone working in a government facility and they have upgraded their studies to maybe a nephrology nurse. Sometimes they expect to be taken to a hospital, they can work in a nephrology unit, but no one cares. They still work in the medical surgical floor, and they'll continue being paid the same amount of money they have been getting since they were employed. Bearing in mind this person maybe has taken a loan to go back to school, so they have to get their money back, but not through the employment. They have to look for extra shifts in private sector, which is unfair. Another thing I've been thinking about, a nurse studies, does their degrees, they do their masters. Here in the United States, if you do your masters, for example, most of the people become nurse practitioners. So if you're a nurse practitioner, people understand, like, yes, this person has done masters, and anytime they can open up their clinics and start working for themselves. But back in Kenya, even if you have done your masters, even if you have done your PhDs, no one wants to recognize this nurse as studied to this level. They want to say a nurse is a nurse, but no, a nurse is not a nurse. A nurse got their own levels. If a nurse has been just a general nurse for 5 years, they go and upgrade their studies, you have to recognize that. You have to recognize that, you have to acknowledge it, and you have to set their job from where they were to the new studies, to the new level they are into. So si mambo ya kufrustratiana, ni just respecting one's decision. Mtu amesoma, amejitolea, put them where they deserve to be, and we stop all these jokes. Yes, ni Rick Skits hapa.